Welcome back to the Muse Capital podcast. In this series, we're talking about the future of how we care. Today, we're thrilled to be joined by the co-founders of Mavida Health, Dr. Sarah Orrick and Emma Sugarman, whose combined experience and expertise and vision are helping families navigate life's most challenging transitions with greater support and understanding. Dr. Sarah Orrick is Columbia University-trained psychiatrist specializing in women's mental health, particularly reproductive psychiatry and perinatal mental health. Her distinguished background includes extensive training in psychodynamic therapy, psychopharmacology, and integrative medicine, equipping her with a uniquely holistic approach to care. Dr. Orrick is passionate about addressing the emotional and mental health challenges faced during pregnancy, postpartum, fertility struggles, and even through experiences of reproductive trauma. Known for her empathetic, patient-centered approach, she's also a strong advocate for greater awareness and specialized support within women's mental health, aiming to elevate care standards across the board. Alongside Dr. Orrick is Emma Sugarman, whose leadership and strategic expertise have been instrumental in building Mavida Health's impactful platform. With a background in healthcare management and innovation, Emma has devoted her career to advancing accessible, high-quality resources for mental and family health. At Mavida, she's focused on ensuring that the care journey is streamlined, supportive, and deeply responsive to patients' needs. Emma's dedication extends to expanding the ways technology can bridge gaps in care access, making it easier for individuals and families to navigate complex life transitions with the assistance and resources they need. Together, Sarah and Emma are bringing a visionary approach to Mavida Health, and we're honored to have invested in their mission at Muse Capital. We're excited to delve into their insights, hear more about their journeys, and learn how they're helping redefine mental health care for families today. Thank you guys for coming and being on the show today.
We're so thrilled.
And congratulations on your recent accomplishment and awards. Mavida Health recently earned recognition as Latitude's Latino Startup of the Year during the 2024 Latitude Match Program. This accolade, part of a competitive pitch event focused on outstanding Latino-led businesses, highlights Mavida's contributions to specialized mental health services for women and parents. I would love to hear if you could just talk a little bit about yourselves, what led you to create Mavida Health, how you came together, and what gaps in healthcare you were seeing that inspired you to launch this platform.
I'll kick it off. So for me, it was really... I was doing this really starting in psychiatry residency. I noticed all of the holes that existed when I always say this, some of the most brilliant psychiatrists would see a pregnant patient or a patient going through menopause and kind of raise their hands up and say, I have no idea what to do here. And it's simply because the education wasn't there, the studies and the research aren't there. But I was so privileged to be at a program at Columbia University that actually had a fellowship, and some people specialized in this space and digging through the small research data that existed to really kind of unearth the fact that female reproductive hormones impact women and those with female reproductive hormones throughout their entire life cycle. So from the moment they have their first period to their last, these really make significant implications to mental health. That's just not reflected in what we're learning in medical school and residency and in the bigger sort of body of research. So I was so excited to be a part of that, and then really dedicate myself to private practice, but realized that there was such a huge need that I was not meeting individually on my own in a small private practice. And I decided to do some education through social media. And I thought all people need is the education, and then they'll go to their own prescribers and therapists and they'll get the care that they need. But the most common message I got was, this is great. Where can I get this care? And then I had my own children and I thought someone else will figure this out. It's not going to be me. The pandemic happened. And after my second child, it was just like a fire that was lit. After I personally struggled as well. And even as an expert, having a hard time finding resources specific for this time of life. And there was a moment where I just thought, I have to do this and nothing will stop me. And I was in search of a co-founder, and luckily I was introduced to Emma, and I'm really thrilled about that.
Yeah. So, by the way, I love to hear the kids in the background. Don't mute it. It's part of the process. You're a working mom. I love it.
Absolutely. No, we came at it really from different angles. It was really fortuitous to have met Sarah when I did, but my background is really on the other side of the house. We always say we're a very complementary duo. I've made my career in behavioral health tech in this broad space of helping people, as your very kind intro said, helping people get better access to mental health care by leveraging technology. But the reason I got into that space to begin with, from a career more broadly in healthcare and business and strategy, was because of my own journey to parenthood. And so my first pregnancy, now almost 9 years ago, ended in a late term loss at 21 weeks. And it, knocked me down, as these things do. I started going to therapy for the first time, which I've certainly come to learn through our experience with Mavida is a common story for a lot of women and birthing people, that this journey and the unique challenges that come along with it are the first time a lot of folks raise their hand and say, you know what, this is too hard. This is too much. And I want help, or I'm willing to accept help, or I'm open to help for the first time. And that was my experience. I walked away from that loss with two big feelings. One was, we don't talk enough about how hard it is to get pregnant and stay pregnant and be pregnant. And as soon as something happens to you, as soon as you have some challenge on that journey, so many people come out of the woodwork, me too, 5 times. It was my family, it was my friends, my coworkers. And I just thought, why don't we tell each other that first? Why don't we talk about that before it happens, so that when it happens to you, you don't have to feel so alone. You don't have to feel so separated. And then certainly the other big feeling I had was that more people need better access to mental health care. Mental health care needs to be more affordable, more accessible, less stigmatized. And so I made a career out of that, but really informed by my parenthood journey. And so these years later, meeting Sarah and understanding what she'd built in her private practice and certainly what she envisioned for Mavida was just one of those formative light bulb moments. I had to do it.
That was how many years ago did you guys meet and start the platform?
Almost 2.5.
I had to convince her, though.
I think it's an interesting thing. It's an interesting commentary on women founding companies, female founders. I had a narrative that did not serve me, but I had a narrative that was not for me. I had made much of my career. I had progressed in earlier and earlier stage companies. And certainly as my career progressed, moved closer and closer to that person, whatever that person looked like, that founder, that person. And I had told myself a story that I didn't want to take the risk, that I was risk averse, right? And that I was happy being right next to the guy. And it was a guy, right? More often than not. I didn't get all the glory, but I didn't have to take all the risk. And it's an interesting thing to then have an opportunity to challenge that story that I thought had served me, but of course had not for so many years, to say, why not me? Why not take the risk, right? Why not be the person making the calls, the person making the decisions, building what I and what we knew needed to be built the way that I and we knew it needed to be done. So that was an interesting and really obviously amazing thing to overcome, and to realize and look back at a career that was so defined by fear in many ways, and to feel so fulfilled and so challenged in such a wonderful way now.
I think it's extraordinary that now we have these brilliant women who are all building these companies that should exist from personal experience. I think that, we've grown up with Instagram and Instacart and Uber and all these things that serve and help. And then it comes to women's health. And it's extraordinary now how so many of our female founders are like, hang on a minute, I've gone through this, it's completely broken. To Sarah's point, someone else is going to do this. And then it's been like, actually, no, that person's going to be me. And I think it's awesome that brilliant women are finally building these companies that should exist. Talking about Mavida, so can you talk us through how it works? How does someone get started on the platform? And what kind of care and support can they expect?
Absolutely. So the kind of care, I'll start there, is, we were really thinking about what do people need during this transition to parenthood. And for a lot of, competitors, or what we saw out there was sometimes the therapy siloed from the medication management. And that, to me, as someone who's a psychiatrist and prescribes and does therapy, doesn't work so well. When you have all of these different practitioners fragmented through the community, it's really challenging for people to have to do the mental load of making an appointment here, making an appointment there, telling one person that they're doing this, their OBGYN, I have a therapist now, I have a prescriber, and we wanted to really bring it all in-house. And so we're really thrilled to provide individual therapy, group therapy, couples therapy, as well as prescribing. And that is prescribing that's very nuanced, because when one is trying to conceive, pregnant, or lactating, there are a lot of questions about the risks of medications. And for too long, so many, intended parents and pregnant patients and those that are breastfeeding have been told, you can't do that, right? It's the policing of bodies. You can't do that. Got to stop that, as if psychiatric medications are optional. And they're not. But what people need to have is they need to be armed with all of the information so they can make the right decision for themselves and their baby and their family. And we're able to do that, and in collaboration with their therapist. So it's really what we call a whole village approach, which is really exciting. And it's been used in other areas like eating disorders, like substance use. And we're really kind of have this idea that this is the next frontier in mental health. That's really the specialized carve out. And then in terms of our platform, it's really easy. You go to mavidahealth.com, and there you start signing up for care. You can answer some questions about your current mood symptoms, so you can actually check in on how you're doing, which often you're given these lists or these forms to fill out at your doctor's office, but you're never told what this score means if you're at risk for depression or anxiety. And so we give you that tool and that assessment on our online form. And there you can sign up for care. And of course, the part of this that's revolutionary is that it's in network, which is something I was never able to do as a private practitioner. You just don't have the leverage to negotiate with insurance companies. Mental health, unfortunately, has just had abysmal reimbursement rates. And so much of the mental health force, unfortunately, in this country is cash pay. And that's not something that can be accessed by the masses.
And so where can we find Mavida? Talking about insurance. So where are you in network?
In California, New York, and New Jersey, we provide clinical care today. In all 3 states, we are in network with Aetna and most major Blues PPOs, as well as Horizon Blue Cross Blue Shield in New Jersey, and in California with Magellan, which is the behavioral health benefits for some of our Blue Shield members, as well as Cigna, or Evernorth, as they are now known, in California, and soon New York and New Jersey.
What has been the shift? Why do you think the insurers are now open to having mental health services for this particular group in network?
Well, I think there has been a lot of movement just on the national scale in terms of parity and making sure that mental health reimbursements are catching up. But I think outside of that, because our colleagues in the mental health world are still having so much trouble navigating this world, especially with insurance providers. But for this specific slice is that insurance companies, and we haven't had to sell them on the fact that when you don't take care of patients' mental health, that when they're pregnant or postpartum, you are going to pay a lot more for either complications of childbirth, because again, and this is so important to note, that depression and anxiety and mental health issues are the number one complication of childbirth. They lead to other complications. They lead to less prenatal visits, likelihood of maybe gestational diabetes and not wanting to go back to taking insulin or following the diet regimen. There's increased risk of preterm delivery, of C-sections, which are 2 or 3 times more than vaginal deliveries, as well as longer NICU stays. And insurance companies know these costs are exorbitant. And so they know that by funding this, they can really avoid a great deal of cost, not just for the mother, but also for the child. We know that when moms have depression, let's say in the early postpartum, they're less likely to take their children to have vaccine appointments, for example, or to well visits. And instead, they're utilizing the ER a little bit more. So it was fantastic for us to experience. We were armed with all of this information and ready to like pitch it. And they're like, oh, no, we know all of that. You don't have to convince us there. We just want really high quality services. And we haven't found that yet.
I mean, it's a discussion around, right, ROI, around cost avoidance. It's so important to drill down on what Sarah said, that mental health conditions are the number one cause of death amongst pregnant and postpartum women, which means more women are dying by suicide and overdose than by any other complication on this journey. And this is all parents, right? No matter how you come to parenting. And yet, there are a lot of things we do have preventive, thoughtful care for. Gestational diabetes is a classic example. Every pregnant person has had the gross drink, has had the GD test. And yet we're not doing enough preventive or even after the fact, right, care for mental health conditions. So that it was an incredible experience to get in those virtual rooms and have folks say, oh yeah, no, great. Absolutely. How soon can you start?
And who are some of the patients that you serve? Give us a description of a few of the types of women that come to you or families that come to you and the range of profiles that you see. My hope here is for people listening, that they find themselves somehow when they listen to you and identify with one or more of these profiles and realize that there's a place for them to go to.
Absolutely. I think we start from the journey of trying to conceive. And even though we do talk a lot about mothers and moms, to us, that seed that's planted when you even do an egg retrieval, when you are doing that, you are already making a decision. This is something I maybe want to do. I want to be a mother. And to us, that's sort of the inception of a mother. The minute that idea that you want to have a family is kind of planted. So we have people all the way from trying to conceive. They are maybe using assisted reproductive technologies, which is increasing in the population. And we know that population has a really high risk of depression and anxiety. And so we start there. We see patients who are potentially seeking other ways of having children, including adoption. And we have seen, even if it's the patient, if it's not the non-caring, right, the non-birthing parent, whether it's because they've used a gestational carrier or it's the father or other non-birthing parent, we also see them because it can be distressing as well. We see pregnant patients as well as those that are postpartum. And again, postpartum for us has a lot of different definitions. It's not necessarily that you birthed the child, but when you have a child introduced into your home, whatever way that is, there are brain changes that you go through. There are so many significant psychological, sometimes even physiological changes that happen that we support everyone on those different journeys.
Yeah, and we see patients and women on a wide variety of acuity as well. And so we've been able to see and hold members of our community who are, for example, experiencing their first episodes of mania, postpartum psychosis. So much in the way sort of an intensive outpatient program would work. We could see those patients several times a week, all the way more to our more average patient who's in therapy or medication once a week, every other week. And so it's a real wide range, both in terms of how you arrive at this parenting journey and certainly at this moment of this inflection point of need, but also what that need looks like. And I think what's really wonderful about our model as well that Sarah highlighted, because we have these services in-house, does not mean that it is a one size fits all, does not mean that every patient looks the same, that every need or every cadence looks the same, but rather we're able to flex it to that unique individual's need, which may also ebb and flow over time. And so because we don't strictly define the postpartum as a classic example, either in how you arrived at having a child or at what that time frame looked like, how long ago a child became part of your life. We see folks ebb and flow in their level of service as well, and their level of frequency as well, and that all works just fine within our model.
I would also say that some of our sort of competitors and what we see that's very different is that we are able to see a very diverse group of diagnoses. We're not just treating depression and anxiety, which we'll see as I think a population that's served by a lot of different models, but we do see patients who maybe have a history of substance use, ADHD, bipolar disorder, again, a bigger breadth, because we realize and we know that just because you become a parent doesn't mean that those mental health issues that maybe you had go away.
And in fact, oftentimes they become more challenging.
I think it's fantastic that there's a company like this that exists. I certainly know I've been through a journey of IVF. I know how traumatic that is, and not just on the woman, but also on the partner. And given that now these subjects are less taboo, right? People that are struggling with something like IVF or whatever issue you're going through, becoming a parent, I think it's a wonderful thing now that there are places that can help, because just from my own personal experience, I know with you, Asya, and like our friend circle and our work environment, so many people are now going on this journey where it used to just be in silence and kind of not talked about and hidden. How amazing is it that there's now a place that couples can go to actually talk about this stuff?
It is a lonely place.
Yeah.
I mean, and even though people are talking about it more now than ever, it's still a really lonely place. And IVF is, people are keeping it to themselves, and until the end, if they're lucky to be successful, and then suddenly it comes out. I know for me, I kept it a secret for many, many years, 7 years really of struggle, and you go on Google going, I need help, and it's really hard. That's really kind of what you're left with, and it's just really difficult to find support out there. And it's one of the main reasons that we were so attracted to Mavida when we met you guys, and we knew that you were onto something really important.
Can you guys talk about just what's going on in the market today? How many people is this actually affecting? Like, how many people can and want to use these services? Because we hear these things where like, oh, it's a niche, and it's a small part of the broader mental health scope. And so I just wanted to throw that back to you guys and say, how big of a problem is this?
It's a big problem. So we know estimates of postpartum depression and anxiety, or this broader category of perinatal mood and anxiety disorders, which is what everything fits under, impact at least 1 in 5 women in the postpartum, but we believe that estimate to be much higher. And we believe all of these estimates, I will say caveat, to be very low.
Underestimated,
because to both of your point, we underreport. We don't talk about these things. We do still, as far as we've come, suffer in silence in many ways. But it's probably higher, more like 1 in 3, which is certainly what was represented during the pandemic. We know that, what is it, Sarah? A third of those cases begin in pregnancy. And that incidence of the same issues of anxiety, depression, mood and anxiety disorders amongst those folks who are struggling to conceive is, again, the estimate is 1 in 2. I have to believe it's 1 in 1.
Everyone you ask anecdotally who's gone through assisted reproductive technologies will tell you that it's 100%, that no one escapes it. It's very rare. So even that is an underestimate. And so these populations are getting quite large, right? Is it 4 million births or 6 million?
6 million births a year. That's right.
6 million births in the US a year. And then we're seeing that, again, that population increase that's using the assisted reproductive technologies. And we think that, that can even start at the egg retrieval, or at the times where you're having to make that decision of freezing your eggs, for example. Even if you're in your late 20s, early 30s, and you're kind of making this decision, there's a lot of implications to that. And whether you have a mood or anxiety disorder, there's things that you're thinking about, right? That might even be a place to kind of start the conversation. And it's certainly a time where you can start to see someone at Mavida Health.
And it's all exacerbated with hormones, and there's just so much at play. And so great that this is accessible to all through insurance, and it's not just a premium product, which is also one of the really defining things of Mavida.
Can Mavida providers prescribe medication as well as therapy?
Yes, absolutely. And so that's one of our very clear differentiators, that we have all of those categories. So that's individual, group therapy, couples, and then that nuanced prescribing that is really hard to find. Reproductive psychiatrists like myself, there's about 15 programs in the country, and maybe 1 to 2 medical doctors. So that's someone with an MD, a degree, that can do those fellowships. And so it's a very, very small group, and that can't serve the population that needs it. And so we've been very invested in training mid-level providers. So that's psychiatric nurse practitioners, that's master's level therapists who want this training. And we've created proprietary training modules, all based on the training I have, because and this isn't popular in the types of places where I studied, but it shouldn't be exclusive. There are a lot more providers that could use this knowledge to really help the population.
What are the biggest challenges that you're seeing in mental health for parents and reproductive health patients today? There's a concerning rise of mental health for parents, 1 in 5 mothers experiencing postpartum depression. What are the largest needs that you're seeing that you're identifying?
So, even the Surgeon General says that it's hazardous to your mental health to have children in the US. And I think there's a bucket of systemic issues, right? This is unaffordable childcare, mass shootings, all of the stressors that we put American parents through. No federal paid leave, and I think these are really important to address. But regardless of that, right, what we're seeing is that parents are burned out, and burnout is really something that coexists with mood disorders and anxiety. And social media may be a stressor for parents as well as it is for children and adolescents. We know that women specifically are more vulnerable to the comparison culture that happens on social media. And I think even early on with Facebook, there were some studies that were coming out that were saying that it was really impacting particularly women of a certain age, right? And that's really reproductive age, the comparison of who's getting married, who's having a child, all those different types of things. But ultimately, whatever the sources are, we know that currently we have a population that is more and more anxious, more and more struggling with depression. And I think there's a lot of other diagnoses. And we really think that clinical care is part of the solution. There's a lot of fantastic organizations doing a lot of support and coaching and peers, but it's not clinical care. And sometimes, you do need that step up, whether it's for short term, but we really think that there is a much larger market for the clinical care than some of these other supportive resources.
In many ways, it's kind of 2 steps forward, 1 step back, because as much as mental health has become more part of the lexicon, and even on this journey, I remember when Sarah and I first started working together, my mom would say to me, it wasn't that we didn't have these problems, but we didn't have license to talk about them. She said she felt much the way that I felt on my journey, that I know Sarah felt on her journey, but she didn't talk to anyone about it. And many of her friends may have felt the same way. They didn't feel they had the right to talk about it. Now, perhaps in many ways and in many cultures, we feel we do. And yet this comparison culture, I think that's such an important thing that Sarah hit on social media. What we see is kind of what we say the highlight reel, right? The perfection view of parenthood, certainly of motherhood. And what that does to us as a society is I'm struggling. No one else is struggling. Everyone else has got it down. Look at her. She can make it all work and I can't. And that really, that contributes a lot to, again, that Surgeon General's warning, this idea that parenthood, being a parent in and of itself is harmful to one's health. And that's really quite the revelation.
This whole concept around perfect mothering and this obsession with perfection, and it's a shame because on one hand, social media is a great tool. I've found it as a great place for sharing information and advice and what you need, what you don't need, and preparation for baby. But then on the flip side, there's this just example of moms who seem to have it all and this perfect motherhood. You say something, there's something you say about there's no such thing as perfect. There is.
Oh, it's just good enough.
Good enough.
Yeah, it's good enough. I love that. And even you can even see it in the wave of gentle parenting advice. Like, it's phenomenal. Listen, we were parented in all sorts of different ways. And this is, it's fantastic to have on social media tools to like mirror your children, to help them identify feelings. But even that sometimes, because you will lose your cool with any toddler, for example, like that feels hard sometimes of like, oh, I screamed at my kid and I'm supposed to only talk to them like this, right? is really challenging. And so I always say there's no such thing as a perfect mother. What we actually want is a good enough mother. And this is not a term I coined. It's actually from a pediatrician who was also a psychoanalyst. They used to do that back in the 50s, and his name is Donald Winnicott. And he basically said that these types of failures that are called managed failures, so that's, not giving your child that toy that they were screaming about, or maybe they don't get the food that they wanted for dinner. Those that are not child abuse or neglect, those actually set your child up for the disappointments and rejection that happens in the real world. But when you are a helicopter parent who tends to every single need, who always gets it right, your children have a different perception of what the world is. And we think, right, building resilience in children is going to be one of the most important things. So it's just good enough is all you need.
So how does Mavida's pricing structure work? And what are the membership options? Accessibility and affordability are huge concerns in healthcare today, especially for mental health. How does Mavida address these needs?
Yeah, that's, it's a great question and it's a great point, because it's wonderful to create a program like this. But if no one can access it, if no one can afford this care, then we're not really helping anyone. And so that's why it was really important and a focus of ours that we go in network with those major plans, that we be able to cover a large portion of the population so that folks can access this care in network. And what that means, accessing this care in network, is that for most of our members, they're just paying a copay for sessions. That can range typically from anywhere from zero, so nothing, to about $50 on the higher end per session, which is a really meaningful difference than how most folks can access mental health care, and certainly specialized mental health care and prescribing today. We do have a membership model, but that sits outside of our commercial insurance relationships. And really the platform, again, the care that we offer through the platform is quite flexible to the individual's needs. So you're not going to see something like you have to stick to this package, which includes this level of frequency of this specific types of care, but rather folks are paying per service that they engage with.
I think the other thing we haven't talked about is that we also have an app. And that includes vetted evidence-based content that our team has all created. It's really meant to bolster what happens in the clinical sessions. So you meet with your therapist, you meet with their prescriber, for example, and they say, I've assigned you some content that's directly related to what we talked about. If you want to do some homework, like when you have physical therapy and you, break your arm, and if you want to get better faster, then you do those same exercises at home. That's really what our platform and our app is for. And we're building out a really exciting community platform, which is coming soon.
That's right. And it's another tool that we can utilize in reflecting how folks are doing in their care back to them. So it's really wonderful. For example, we have activities that our clinicians will recommend in between sessions that really reflect back to patient. What has your journey been like? Where did you come into treatment? And how are you doing now?
That's awesome. And so what's next for Mavida Health? Are there any initiatives, tools that you're excited to unleash, and expansions that you can share with us?
Yeah, absolutely. So as Sarah just kind of teased there, we're building a really phenomenal group chat function within the app to really lean into how our members want to engage in community. We know that folks really like to engage with others at similar stages on their journeys who've had similar experiences, right? It's really meaningful to be able to talk to someone else who says, me too, I understand from experience. So in addition to support groups, we have group chats that can both be based off of a therapeutic therapeutic or support group that already exists, as well as sort of by affinity groups, right? So parents by surrogate, LGBTQIA parents, kind of different populations.
I love that. Absolutely love that.
And of course, we're always increasing the type of content that we have in the mother load. We want to speak to all of the parents out there. So if you had a gestational carrier, we want you to feel that you have a place in Mavida Health as well. So we're always building that more specialized content out for all of those communities. And of course, if you join us now and you feel like that content isn't as robust for you, or you're a special population, either trans patients, gay couples, let us know. And we are actively sort of increasing that library. So again, everyone feels acknowledged and heard in our community.
So as you guys look to the future, what changes would you like to see in the broader healthcare system regarding reproductive mental health?
I think, the issue of parity just continues to come up, right? We've made strides and we're thrilled at the level of access we've been able to provide to care with our insurance partners at Mavida, but that continues to be an issue. Reimbursement for this type of care continues to be an issue, particularly when compared to issues of physical health as well. So we'd like to see that continue to become more a part of the conversation, to see this type of care valued in the same way. And I think meaningfully to understand the nuance between mental health issues and how it impacts the physical health. Sarah highlighted some of this earlier, but the avoidance of higher cost episodes is something that I think is understood conceptually. But there's really a need, I think, for more of a mandate here in many ways, right? Again, when I think of the comparison to an issue like gestational diabetes, this needs to be part of a regimen of care for women, for birthing people, for anyone on this journey, that it's not an option. It's not a recommendation. Rather, it's something that we include in prenatal, postnatal care across the country.
And right now it's a luck of the draw. It is mandated in several states, but it's kind of, if you get the provider who happens to stay in the room a little bit longer and ask you the questions, but if you get the one that was rushed and wants to get out of there and has too many patients, you may not be asked anything. And I think that's a huge disservice. I also think the larger questions here of reproductive rights really impact us directly. I think when people can't choose what happens to their bodies, obviously you can understand that the mental health implications of that are going to be very significant. We already see those that have had loss, termination, right? Whether it's elective or not. And it's already so challenging in the states where people can have these procedures. But of course, across the country, when this is prohibitive, it's going to be, it's just disastrous. When we already have maternal health outcomes in this country that are just, abysmal compared to other developed nations, as a physician, it feels quite shameful, given all of the advances and privileges we have in this country. And so we know that mental health is a huge part of that, and we can't wait to kind of expand our services.
Go Mavida.
The other thing that I'm just interested in is I think it's important that you all invested in us and that you didn't see it as niche. And so I think it'd be interesting to kind of hear your perspective on it, and why you made the investment. But I think we were met even by a lot of female investors by Maven's taking care of this, or it's all, there's a lot of people in this space. And I think we all know that, yes, we're excited that there's more players, but, no one is solving it in the way that we are. And, I think it's just an interesting kind of investment question.
I love that you turn the tables around, Rach.
Right? No, I'm joking.
Ask the work wife. No, it's true. I mean, our job at Muse Capital is to invest in underserved areas. And this is a severely underserved area. And
I think from all of our research that we were doing on the space, we would hear this constant feedback that, mental health is so saturated. There's so many companies out there who, will do what Mavida claim. And, when we dug deeper, we're like, no, this is a very different kind of care. And it affects this very
large population
at a crucial time in their journeys. And, as we've talked about, it's from deciding to conceive or try to become a mother to IVF. There's all of these areas where this applies. And so for us, we just said, listen, I think everything is underestimated in terms of the market stats that are out there. And there needs to be some kind of company that is, the brand for this group of people. And it's funny because we were actually looking for you guys. We had done this research. This has happened in a few of our companies now. We were doing the research and we saw that there was this clear gap and that it just wasn't being met by some of the bigger mental health companies that were out there. And, luckily we got to meet at exactly the right time. And I remember when I told Asia about it, Asia's like, I have to meet this company. We've got to meet this company. And
I may or may not have been struggling with my own mental health issues at the time. So I was like, wait, what?
No, but we just knew just from our research, from our deep dives, from, talking to want-to-be parents, that this was needed. And again, to what we've talked about, many of these conversations in the past have been taboo. People don't want to talk about it. They suffer in silence.
Right.
And enough.
Yeah.
There needs to be a place. And it's so great that you guys are, building in the village kind of feel with the community chats and meeting other people.
Yes. And I know we talked about this when we were kind of, doing our dating to see if we would be a good fit. But I think there's also this element of a lot of employer benefits and not necessarily pitching directly to the consumer. And there has to be a hybrid here. We're doing all of the work behind the scenes to get things in network and, having those big conversations with the big insurers. But ultimately, we do think that it's in the hands of those parents to be, those intended parents, to make this choice about their mental health. And that's why we also really are doubling down on being a consumer-friendly choice and something that people kind of know about, hear about, and can make that decision for themselves.
And say, this is for me. There's so many options that exist, certainly, but there wasn't a recognition of the unique need here. And I think that feeling of this was built for me, that's exactly what we're out there to convey.
So we're so grateful to you too.
It's a match made in heaven, and as you said before, if you're not going to build it, who will? It's similar for us. We unfortunately know the abysmal stats around women in venture, and it takes a woman who has gone through these kind of pain points to really identify and understand how big and prevalent this issue is. And it's a shame for us to have seen just a lack of capital going into women's health companies historically. And at Muse, we're trying to change that. And you are proving to us every day as you build your business that it's excellent business. Profit and purpose can meet.
Record breaking each month, not to mention, right? Yeah, exactly.
How great that you're building a successful business and knowing that you're building that business by helping people in need. It's just it's what makes us wake up every morning, and I'm sure the same for you.
From our perspective as well, there's companies out there that claim to do this, or again, you're paying out of pocket. And we always say, the concierge service for the rich is not where we want to be.
Nope.
We need to be able to provide this kind of access to all. It should be about how much is in your bank account. And so you going in network and doing, and we know how hard that is to be like a first mover in that space. So hats off to you guys. But I do believe that is the difference, and that is the unlock. And combined with knowing that everything in this market is completely underrepresented, we're not surprised that you guys are having the kind of traction that you are today.
On that note, we're so grateful to you both for coming together and building Mavida and really being a platform that people can go to find that much needed support. And we can't thank you enough for joining us today. And for those of us out there wanting to learn more about Mavida and your services, where can we find out more information? Of course, it'll be in the show notes, but I'd love to hear from you. How can they find out more?
Please go to mavidahealth.com. That's Mavida health.com, as well as follow us on Instagram at Mavida Health.
Awesome. Thanks for coming, guys.
Thank you.
Thank you.
you so much for listening. For additional information, check out our show notes, and to find out more about Mavida, go to mavidahealth.com. That's MAVIDA health.com. As always, you can find out more about us at musecapital.vc. And speaking about reproduction, stay tuned for our next episode interviewing Joshua Abram, the founder of Conceivable, pioneering the world's first end-to-end automated IVF lab. Conceivable's automated lab transforms Nobel Prize-winning IVF into a population health solution, making it accessible to many rather than concierge medicine for the few. You won't want to miss that one. Special thanks to our executive producer, Lauren Maddock, and our engineer and composer, John Meek. Ciao for now.